Good afternoon. Welcome to All About Animals. I'm Sherry Gradator, and I am at Cairo Animal Hospital in Highland Park. My very special guest is Dr. Stephen Cairo, who, as you might know, sponsors this show to help us place the animals that we place, but today he's sharing knowledge with me, which is just a wonderful thing. Steve, welcome to the show.
My pleasure, Sherry.
It's spring.
It is.
Okay.
Finally.
Today it's cold out, but it's spring.
Well, the ticks don't care.
No, they don't. And that really is where I want to start, because I dog park every day, and I'm seeing an inordinate number of ticks.
Just in enormous numbers. We're seeing them every single day. We're seeing dogs and pulling ticks off of dogs. And people need to be using the proper products for tick and flea control this year. There's a lot of things that are over the counter that they can buy, but they should really consult with their veterinarian, at least find out what the products the veterinarian recommends, and then decide where they're going to get it from. Some products are much more effective than others, some are much more safe than others, and that's the important thing, because we've had some products with some of the over-the-counter preparations that have been slightly toxic to a lot of animals, and for that reason, that's why they need to talk to their veterinarians to find out which are the safe products to use.
Wasn't there a big article just recently about some product that they said had caused dogs or cats to die?
There is a product out there, and we won't mention the name.
No.
People can research it, and it's a function of A, being used properly, and being used properly for the right reason in the right breed. Some breeds seem to be a little bit more predisposed to sensitivity to some of these products. So we have to be very careful, and some products are absolutely forbidden for cats because they will kill a cat. I mean, there's no doubt. And you don't want to be using the wrong products on your cats either.
Okay, and we know there are lots and lots of ticks out there. God knows there are a lot of them.
A lot of ticks. We had a real, it's interesting. We had a lot of snow, but we didn't have a lot of cold. We only had a couple of days where it went below zero. So the snow formed sort of a blanket on the ground, and it allowed the ticks to only need to burrow in a few inches into the soil. And then when the snow melted and the soil was soft with all the moisture, the ticks came right out early March. And beginning probably early March, we started to see ticks. And then by mid-March, we were seeing a lot of ticks. And now we're just inundated with ticks.
Okay, let's talk about ticks. What's bad about ticks?
Well, ticks certainly they're a nuisance to begin with. I mean, nobody wants to see a tick crawling up the draperies in a household, or certainly see it on themselves, because ticks will attach to people. Most of the ticks we have in this area are brown dog ticks or American ticks. But the ones we really worry about are some of the ticks that can transmit certain diseases, such as Lyme disease, which is transmitted by the deer tick. And the deer tick is very tiny. I mean, if you took a pencil and made a little tiny zero with it, almost as small as you can make it, that's how big the deer tick is. So trying to see a deer tick is almost impossible. So tick prevention and treatment is really important. And certainly if we can vaccinate for a disease such as Lyme disease, I'm a full believer in it. We do see Lyme disease in this area. We diagnose it every single year. And while it's not transmissible from the pet to the people, if your dog does get Lyme disease, it's important that A, well, first of all, try and prevent it. Second of all, it gets diagnosed very quickly, because if Lyme disease is allowed to go on and create joint problems, even neurologic problems, it can leave a lot of telltale and lasting deficits in a patient, with Lyme disease. Even people who get Lyme disease, if they don't get diagnosed early in the disease, can have some long-lasting neurologic issues.
And very frankly, a dog that has a deer tick on it can come in the house and bring a deer tick in, at which point, although the dog can't give Lyme disease to the person, the tick that came in with the dog certainly can.
Absolutely.
And we have no vaccination for people.
Not yet. I mean, they're working on it. I mean, they've established one for animals, for dogs, and they're working along the same lines to try and get that perfected for people.
Which would be wonderful, but right now we don't have it.
Not yet.
Really the only way to prevent the Lyme disease, the deer tick that transmits Lyme disease, is to keep it off the dog.
And keep it off yourself.
Keep it, well, yeah.
Right. I mean, you should be wearing long pants, long sleeves, and check your sleeves and your arms. Even check your scalp, because that's a very common place for people to find ticks in their hair.
Yeah, that's
it happens.
That's creepy. Come on, that's creepy. Okay, fleas aren't out yet.
No, they are.
They are?
We're already seeing fleas. We had a couple of 80-degry days, and it doesn't take much more than one or two of them for the fleas to say, "Yahoo, we're ready," and they do. And they come out. I mean, we usually don't worry about fleas until May, but we're already seeing them because of the few 80-degree days. And these cold days, these 40-degree days, and these high 30 nights, they're not enough to put the fleas at rest for a few days. They'll come right back the next day and be ready to go. So again, flea and tick control is important, even this time of the year, through and including the month of December. People kind of forget about it and they say, well, you know, it's Thanksgiving, how much can there be? Well, I'll grant that there may not be many fleas, but ticks make a resurgence in the fall again. So unless there's 3 consecutive days of snow on the ground, you're going to have fleas, you're going to have ticks.
Okay, so fleas and ticks. Let's go from fleas and ticks to heartworm, because that's the other big one.
It is.
And that there's been a whole change in the approach of heartworm preventative medication on.
Well, the change has been where we used to perhaps have used it on a seasonal basis because it's transmitted by mosquitoes from the mosquito to a dog. The issue became one of, if it was only transmitted by mosquitoes, why do we need to worry about it in the wintertime? And the answer is, quite frankly, the parasite takes several months to develop inside the dog's body. And the heartworm medication that you give your dog on a monthly basis, whether it be oral or whether it be topical, is only in the body for 3 days. And then it's out of the body. So it isn't like you give that pill on the 1st of May and it lasts for the whole month of May. On the contrary, it works in retrospect. It's actually taking care of April. And anything that may have occurred in April, it will arrest and keep from developing into an adult heartworm. And we know that if we stop the medication, as we used to do, you know, 4, 5, 7 years ago, stop it in, let's say, January, February, March, because it was cold and there certainly weren't any mosquitoes at that point. We were having dogs developing heartworm because of that break in the coverage that we were offering the dogs. And stopping it in December, January, February, March is now contraindicated, because if the dog gets exposed to it in October, which is very common, if you stop the medication, we then give the opportunity for the parasite to start developing inside the heart. And once it develops into a full-fledged young adult, well, as a young adult, you're not going to kill it with the heartworm medication, and then we have to go into a whole different protocol, much more dangerous, much more serious protocol to really treat for adult heartworms.